So I'd had a period of time of about 18 months, a year to 18 months of a lot of stress, and it was related to aging parents and passing parents. And I was dealing with it intellectually. I wasn't dealing with it emotionally. And I started to develop foot pain, which initially presented as a plantar fasciitis. And on my to-do checklist was to do 2 half marathons. I'm not a runner, but I was training. And I thought, makes sense, plantar fasciitis, yada, yada. Finally, 6 years passed with this pain. I got a call from the head of MSK tumors at Mount Sinai, and he said, "Oh, by the way, Liz, we've got your biopsy back. It's not what we expected. It's a synovial sarcoma." Like in that immediate moment, your stomach kind of drops. So I sort of looked at my life at that point and went, "Wow, okay, not what I was expecting, but I'm not really surprised with the level of stress I chose to put myself under. I was running at." What I hadn't factored on was me getting older and this location of this tumor in my foot, that the foot itself would get weaker and weaker. So I was hiking in Australia in 2017 and I had a slip and I hyperextend my foot and open up the tumor, and the pain went to like a 20 out of 10. It was really, really bad. It ends up that I had a number of things that led me down this journey that showed me opening up my world on the other side of doing a right below-knee amputation.
Good morning, everybody. My name is Dr. Colin Elkin. Welcome to the Vitalistic Voice. And, if you've been watching the podcast, we've had some really, really special guests on the show. And this morning is no different. I have somebody who I've been, and I'm going to be honestly, I don't know if I've ever told Dr. Liz this, but I've been an admirer of hers for such a long time, just because she had just such a beautiful practice, and she just has such a wonderful way of being present with people. And I've seen her speak numerous times, and I've been in a little bit of contact with her, but I'm so looking forward to this time that we have together this morning to really do a deep dive into who she is and what she brings to the chiropractic profession. So I'm really excited to introduce Dr. Liz Anderson-Peacock. Thank you so much, Liz, for being with us.
Oh, you're so welcome, Dr. Colin. It's an absolute pleasure and a delight. We'll see what the next amount of time is going to bring.
I'm so looking forward to this. So I would love to go way back, and I'd like doing this with all of our viewers because I'm really excited to know, because when you're a child, you don't run around with your friends and say, "Hey, I want to be a chiropractor." Somebody, when I was running around with the little boys in my neighborhood playing road hockey or whatnot, somebody would say, "I want to be a professional hockey player," and somebody else would say, "I want to be a fireman," or "I want to be a policeman." It's rare, unless you come from a chiropractic family, it's ingrained in your mind. You don't say, "I want to be a chiropractor." So I'd love to know what inspired you to go to chiropractic school and then serve in the profession.
Okay, well, thank you. That does go way back. That goes about 45 years back, actually, for me. And so there was a couple of things. One is I was on scholarship at University of Winnipeg, then University of Calgary, did a Bachelor of Science. And I was in university for 4 years. But after 2 years, I had my groupings of friends that went into dentistry, went into medicine, went into law, went into this weird thing called chiropractic. And I'd never even heard anything about it. And a couple of high school chums had literally gone into the profession directly after their second year of university. So I was in third, fourth year and observing what was going on with all my friends in the different professions. And long story short, my friends that went into chiropractic were espousing life and movement and principles of health and prevention and maximizing performance and, yes, dealing with symptoms. But there was a whole different spirit behind what they were doing that really attracted me. And they were able to use their mind, they were using their body and assisting, with caring for patients, which was certainly attractive. And I was at the time I was dating an MD, a student in medicine, and it was a whole different ball game. Like, that circle of friends were under high stress. A lot of them were on medicines to deal with their stress levels, just with the volume of information and the competitiveness of it all. And it was just a very different spirit of for me to observe what the two different kind of groups were going through. In dentistry, the world is the size of your orange, and I wanted my world to be bigger than the size of an orange, so that didn't really attract me. And so anyways, lo and behold, I started to sort of look up chiropractic and did a little bit of research on it. And how the universe loves to work is I hurt my low back And so I went to a chiropractor because that's what I thought it was for: back pain, neck pain, headaches. And this is in the 70s. And this chiropractor that I saw was really, really interesting because it was my low back where I had symptoms, but she looked at my full spine. And of course, I'm pretty curious about, why are you looking at my spine when the pain is right there? And she proceeded to articulate that the everything is interconnected, and you don't want to just look at one part because you could miss other keys to the puzzle as to what's going on. Made sense to me. Then out of the blue, when she's palpating my neck, she starts asking me about allergies and symptoms with allergies, or hyperexcitability of an immune system response. And this really got my attention because as a child, I went through 10 years of allergy shots from the age of 6 to 16, once a week, max once every 2 weeks. 10 years of that, no change in my allergies. And I had, the hay fever, you name it. I had the skin prick tests, and I was allergic to basically everything alive outside from now through till the first frost. I had an air purified bedroom, or an air purifier in my bedroom. And I remember as a kid, I had a glass of water, and beside my bed, I either had pyrobenzamine or Dime Tap or Allerest, because I remembered as a kid thinking, if I can chew that pill before I get out of bed, and I chewed it, didn't just swallow it, then my symptoms would go away and I was healthy. So this really had my attention when this chiropractor is asking me this question. And I'm like, what the heck does that have to do with my low back, right? And let alone my overall health. And then she asked about any traumas that I was aware of. And I had a significant trauma when I was a child. Before there were seat belts, let alone car seats, I was in the front seat and my mom I don't know exactly what happened, but I hit the dashboard and had 2 black eyes. And I remember as a child, everybody looking at my eyes, but no one looked at my neck. And when this chiropractor, when I was 18, took films on me, my neck had sort of this reversal curve and was not functioning very well. So she's asking me about the allergies, and I'm like, what does that have to do with my spine? And she said, well, it has to do with your nervous system. And I'm like, explain more. And she says, well, what causes allergies? And I said, well, for me, pollen's in the air, hay fever. And she said, well, if pollen's in the air cause allergies, and you and I are breathing the same air at the same time in the same space, and you have symptoms, but I don't have symptoms, is that really the cause of your problem, or is it your body's not adapting to the pollens in the air? Sneeze and move on. Recognize it not as a foreign invader with an overreaction. And all of a sudden I went, oh, never even thought of that question. Never even thought of it as a next step as to why was my body over responding to the environment. And she said, well, I surmise, can't guarantee, but I surmise probably related to your nervous system is on hyper alert. And certainly my tendency is as a driver and a go-getter, and stimulation, let's overstimulate myself. And at that time, I didn't really know any different. And I said, let's proceed with the adjustment. So she adjusted full spine. But when she got to my neck, it was like someone had taken earmuffs off my ears, even though I'd never tested for a hearing problem. And it was like I had an upgrade in my computer, in my brain. And there was just this absolute clarity and this level of awareness that I had. And that was so pivotal for me. Forget the low back. That was like a non-issue. That is what turned me into wanting to go to become a chiropractor. And then long and behold, I go through school and I become a chiropractor. So there you go.
What a brilliant story. That's incredible. And what a great way to be able to explain the principle in that analogy. That was fantastic. So well done. So can I ask you then, so after school, so you went to CMCC?
I did.
CMCC grad, and then what happened after that?
So I started in my practice, and it's really funny because I was a cum laude student in clinic. I did really well, especially in clinic. And so I was having this expectation that people would just arrive, come to me, right? And boy, did I have a wake-up call, because that's not what happened. I did not know, I knew how to take care of patients, but I used language that patients didn't understand. It was too technical. For example, I remember this one person was having some radicular arm pain, and I was explaining what was going on in the technical terms, and the patient didn't come back. And I'm like, why did they not come back? And the whole reason why they didn't come back is they went to their medical doctor. Their medical doctor said they had a pinched nerve. And I'm like, of all the people that, traditionally that's what we would have said as chiropractors. So I learned to change my languaging, but I really struggled my first 2 years in practice to the point that I remember one day sitting and I'm looking at my library and there's this piece of paper, like literally a piece of paper that I pull out, and it's my essay on why did I want to become a chiropractor. And I read it and I lost it. Like I was by myself, but I was like, I'm not doing anything that is on this piece of paper. What the heck happened to me? And on the piece of paper, I was talking about why I wanted to go in was to help transform people, improve potential, increase function, have people have greater self-awareness. And I was dealing in a very different model. And at that point, I said, I need to get help or I need to leave the profession. So I started to look for a coach, and this was in the 80s. And I had a lot of colleagues that had gone to, had a coach, and it was James Carter. So I went into the James Carter program, and he really sorted out my brain. And I would say that the two top things that I learned from him was about responsibility and commitment. That we are responsible for our thoughts, our feelings, our actions. We are responsible to the commitments that we make unless we can't make, unless we have to alter the commitment and then we need to renegotiate an agreement. But it was about the commitments that you make to your patients, and don't bite off more than you can chew. Stay in your own lane. And he just sorted out how I was communicating with patients. And from there, I went into basically a full practice within months and carried that through for decades until I sold that practice, and my son-in-law and daughter and stepdaughter took that practice over. And now I'm in part-time practice, really boutique in that I'm seeing pediatrics and pregnancies that are complicated cases that colleagues refer to me, and I sort them out, send them back, and it's awesome. It's great. Yeah.
You're such a great communicator. And I know, in the talks that I have with people, and you see this throughout the profession, is that the chiropractors that I know who have built the biggest and most successful practices, if that's the way you define success, where you're able to transform lives, have become great communicators. And I know you built a very, very healthy, very big practice in Barrie, Ontario. And I know you had a pediatric specialty, if you will, and a preference to see families and children. So can you talk a little bit about that? How did that derive, and was that a lot of fun for you?
Yeah, so it was a pediatric focus for sure, and special interest there. And that really came because early on in practice, I had a case, and the mother was a client, and the baby was not. The youngster was not. She was 18 months of age. And the mom said, I'm having a challenge with my daughter, and she's 18 months of age, and she's commando crawling. So she's just using her arms and dragging her legs. And I'm like, sure, like, let's have a look. Let's see what's going on. And this little one had been to a neurologist, had been to an orthopedic surgeon. And so when the child comes in, I'm looking at this kid and I'm like, okay, what am I going to do? Oh my gosh, so I went through all my orthopedic testing, I went through all my neurological testing, all of that was normal. And then I went, I guess I better do the chiropractic thing and palpate the spine and look at the function of the spine. So in palpation, what I found was this little one's sacral base was posterior. And I remember my report of findings, again, I'm pretty fresh in practice here. And my report of findings to the mother was, this is not, I explained the sacrum and how it's supposed to function. I said, this is not functioning normally. I'm going to adjust it, and this is how I'm going to adjust it. This is what we should expect from the standpoint of a response from the adjustment. Whether that will change the function of the legs, I do not know, but are you willing to give it a try? I really don't know how long it's going to take. My role, though, is to make sure that we have idealized function of the spine, and we use the spine as a conduit or an access point into changing the tone or tension of the nervous system. And this is where the nerves go down into legs. So that was my explanation. I set up on this little one. I do an adjustment. There was actually an audible release, which I wasn't expecting because of the immaturity of the joints. Anyways, I give this little one back to the mom, and my management wasn't so hot back then, and it was, give me a call in a couple of days and we'll figure out what we need to do next. So a couple of days later, I get a call in the office, and my staff are interrupting me with another patient, which usually my rule of thumb is don't interrupt me when I'm with patients, catch me between. But because the mom was on the call, the mom was crying. My staff thought it was a bit of an emergency. So I excused myself from the current patient, said I would be right back. And the mom is crying because she is saying her baby is now bringing her knees to her chest and is rocking on all fours. 2 days, one adjustment. And from there, this little one carried on and just started healing. And I remembered thinking at the time, it really made me nervous in that I didn't feel I was equipped in a way that I needed to know the differentials and more having far more tools than what I had from what I was educated in. So then I did my diplomate in pediatrics, which back then it consisted of going to Chicago 12 times a year for 3 years for 12 for 360 hours of in-class time. Plus there was presentations and final exam is like 8 hours and so on and so forth for my diplomate through the ICA, which was the only one at the time. And I was so happy with doing that because I really understood what my lane was, what to look for that were abnormals that needed obviously medicine or a consultation in the medical world, or even occupational therapy or physiotherapy. You know, a typical example is I saw a little one in November, and this little one had a cephalohematoma so huge. Plus, there was skin tenting. There was this very weak cry. There was all these red lights that went off, and I went to the mom. There is chiropractic work to do, but we need to route you immediately right to the hospital. And you don't go home, you go straight to the hospital. And this little one was literally transported by ambulance down to Sick Kids Hospital and was there for about 3 weeks. And so there was other things that were going on. So I think that's where I'm very confident in knowing what's in my lane and where I refer people out accordingly that way. And that's why I did that program, was specifically to learn a lot more techniques on adjusting, how to do assessments, how to do age appropriate, growth appropriate, development appropriate assessments, and then what to do from that standpoint.
Cool. That's so cool. You know, and you see it, you see the excitement in chiropractors who really focus on sharing the principle with people and have a preference for seeing families and seeing people beyond the musculoskeletal type of stigma that we have gained as a profession. And you see it resonate in families. And you mentioned something that your daughter is a chiropractor and your son-in-law is a chiropractor and took over your practice.
Yeah, yeah,
So isn't that cool? Because I mean, I have an oldest son, also same thing. My wife is a chiropractor too, and he grew up. All my four boys grew up in a chiropractic family. They know nothing different, and it would be abnormal for them to think about taking medications or anything like that. And of course, my oldest son now has become a chiropractor, and his girlfriend, who's now his wife, decided to follow in his footsteps and is also a chiropractor, and now they have a child. So I have a granddaughter who's growing up in a chiropractic family as well. So can you talk about that transition with you now migrating out of your busy practice and your daughter and son-in-law taking over your practice?
yeah. Well, initially they were with me in practice, and then I had developed this whole thing with a foot issue and had a surgery, yeah, minor little surgery, a little flesh wound. And so I really couldn't practice and I couldn't commit to what I needed to in the way that I had before. And I thought it was just easiest and less stressful for me to let all of that go. And that was not easy because I really defined myself by the patients that I was seeing. And if I wasn't seeing them, then what does that mean, right? Am I really a chiropractor if I'm not seeing patients? And I kind of got a smack job with a couple of my good colleagues, figuratively, on just saying, well, would you say I'm not a chiropractor because I'm not seeing patients? And of course, well, no, of course you're a chiropractor. So why are you so special? So they got my head on right, saying that there's a lot of different ways we can be serving and not necessarily having patient care as being the forefront. But they took over that practice, and it really took a load off me from a standpoint of responsibility so that I could do some healing that I needed to do after my right below knee amputation. And then it was really, people kept calling and saying, I'm having a challenge with this child, or colleagues were saying, what would you do with this? I'm like, it's really hard to say what I would do unless I see them. And so lo and behold, in my home, I have a huge home, and it works perfectly to see people because you can come in the front door, turn left, there's a washroom, a closet, and my office. And it's so simple. It's so easy. It's flexible. So it really works with my scheduling of being traveling and teaching and coaching and seeing people as well. So It works really well, but it wasn't easy. And it was me that wasn't making it easy. All right, I'll put it that way. And it was having to let go of things that I defined myself by, and you start to realize, wow, I'm so much bigger than a body part. I'm so much bigger than my practice. I'm so much bigger than a thing. And that was sort of a really great reminder of where I had allowed myself to get out of balance with myself.
Wow. Wow. So if you don't mind, let's talk about that, Liz. I'd love to know, because as sometimes as chiropractors, and maybe I'm speaking on my own terms here, is that we feel somewhat indestructible. We get adjusted regularly, we eat well, we practice all of the good things that bring a healthy lifestyle, in our life. And when we have a challenge, like something like what you had, then it takes a step back saying, why is this happening? This is not supposed to happen to me. Can you open up the door and talk a little bit about what happened and how this all came about?
Yeah, and I'm going to say there's a bit of arrogance that comes through that too, in the standpoint of, well, why can't things happen to you? Because we are human, we are a body, a spirit in a physical form. So I'd had a period of time of about 18 months, a year to 18 months of a lot of stress. And it was related to aging parents and passing parents. And, my dad had to put into a home, father-in-law into a home, mother-in-law has a stroke, has to go into a home. My dad dies, my father-in-law dies, my 16-year-old dog dies, my 14-year-old dog gets hit by a truck. And I mean, it just went, my brother has an experimental surgery, lands him in a hospital for 16 weeks. And oh my God, it was just a lot of stuff. And I was dealing with it intellectually. I wasn't dealing with it emotionally. And so the best I can say is that I had created a lot of stress in my system that had changed my set point into a different, into a way of living that was not going to be doable over a long period of time. And I started to develop foot pain, which initially presented as a plantar fasciitis. And on my to-do checklist was to do 2 half marathons. I'm not a runner, but I was training. And I thought, makes sense, plantar fasciitis, yada, yada. And except it persisted. And I ended up and then I could feel a lump underneath my foot. And I'm like, what the heck is that? So I went to numerous professionals, medical, physio, chiro, and finally 6 years pass with this pain. And I finally get an MRI. And then it's like, okay, you got something in there. What is that? And then that proceeded into a biopsy, which was really not fun when they're sticking a needle sideways into your foot to do a tissue sample. And literally on a Tuesday night, I get a call from the head of MSK tumors at Mount Sinai, which I was appreciative. He called me because I didn't have to drive down and sit for the news. And he said, "Oh, by the way, Liz, we've got your biopsy back. It's not what we expected. It's a synovial sarcoma. You need to get a CT scan of your chest and brain because it metastasizes to chest and brain, and you've had it for quite a good deal of time." And I'm just like, oh my God. Like in that immediate moment, your stomach kind of drops and your brain is sort of in overdrive on what does this mean to me, my family, my husband, my practice, yada, yada. And then I went into my mental mode, of course, and I'm like, okay, synovial sarcoma. Let's go through the Rolodex of the family of sarcomas. And wasn't happy with what I was seeing on that and just totally taken aback. And then I'm literally sitting in my office after doing a bunch of research and I'm looking up and there's Bruce Lipton's book, Biology of Belief. And of course, the first thing that comes into my mind is like, cell cannot be in two things it's either in one or the other. It's either in growth and repair or stress and defense. And your body, you have to make a decision on which way you're going to do, mentally affect your physical form with that. So I sort of looked at my life at that point and went, wow, okay, not what I was expecting, but I'm not really surprised with the level of stress I chose to put myself under, I was running at. And at that time I thought, okay, so how do I deal with this naturally? And lo and behold, comes to me a name, and it's Nick Gonzalez out of New York City, who treats cancer naturally through really nutrition specific protocols, detoxing, enzymes, things like that. And I was a client of his for 10 years and I was never worried about the cancer. So I had the CT, had everything. I was never worried about the cancer. It was just the pain in the foot that was the issue, which changed my gait. And, there was some chronic pain there for sure. What I hadn't factored on over time was me getting older, and this location of this tumor in my foot, that the foot itself would get weaker and weaker. So I was hiking in Australia in 2017, and I have a slip, and I hyperextend my foot and open up the tumor, and the pain went to like a 20 out of 10. It was really, really bad. I've had reconstructive knee surgery on my left knee, and that pain was 2 out of 10. So for anyone that's had knee surgeries, this was like a 20 out of 10. It was crazy. And the only time I could get out of pain was when I was meditating, and literally could get out of my body. And I went, this is not doable either for a way of living. And I would say it was really Joe Dispenza and the work that he's taught me that really helped me navigate through this, in that I was using matter to change matter, meaning I was using nutrition and detoxing and other modalities, chiropractic, everything else, but from a materialist standpoint, to change the material in my body, the tumor. And that requires time when you're functioning at a lower vibration or trying to force it, will it, need it, have to, got to, Liz, you can do this, right? And I wasn't able to get up over the hump of the other side beyond and bring my future towards me. So I was using my past experience and bringing it forward, which means I'm going to have the same future, right? So it ends up that I had a number of things that led me down this journey that showed me opening up my world on the other side of doing a right below knee amputation, which was really the treatment at that point in time. And so I was in one of the advanced meditations of Joe's group in Portland, Oregon in 2017. I'm on the floor at this point. We're doing this 4-hour pineal gland meditation, and I'm in space, meaning I'm in the nothingness. I'm in the void. And when I say I, it's not me, it's my essence, it's my awareness. I'm not there in a physical form. So it's just this awareness that I'm having. And I felt so at home, like so connected with this presence of this intelligent, universal intelligence. And I had a very clear message, and it was, you're so much more than a body part, let it go. And I'm like, well, that's kind of interesting. And I come out of that, I'm a little bit discombobulated. And then a couple of months later, we had already prearranged a trip to go to South Africa. And so we're in South Africa, and this huge elephant, his name is Rambo, 18 feet tall, 6 tons, comes to me. And I'm palpating, I'm loving on this elephant. Like I'm touching everything. I got my hand in his mouth, feeding him hay. And I'm having this connection moment with this elephant. And I've got goosebumps up my arms. And all of a sudden I have tears rolling down my eyes, my face, I should say. And this elephant gave me another gift. And he was saying, universe is safe, surrender. And it wasn't surrender as in give up. It was surrender as in allow, just allow. And I asked the handlers, like, why is this elephant at the sanctuary? Like, what's wrong with him? He's perfect to me, Lo and behold, this elephant had to have a partial amputation on the end of his trunk because he'd had a plastic bag wrap around it like a tourniquet. What is the likelihood of one considering an amputation? You go to the other part of the world, and an elephant comes up to you and gives you that message that you sort of intuitively have. So what I saw was this opening up of an opportunity beyond the amputation, where there would be ease and expansion and growth. And if I carried on in the same space, I was having more shrinkage in my life, more shrinkage, just less vitality, less ability, less everything. So I went through the procedure. And that in itself was an awesome experience, which sounds really weird. But I had seen everything roll out in a different path, literally in a different potential in the field. And I saw everything happening before it happened. And so, as you know, I did a post to tell people that if you were going to assist in any way, first of all, I did not want any condolences on, oh, poor you, you had cancer, oh, poor you. I didn't want any of that. Don't even come near me with that energy. What I want is faith, love, joy, grace, wholeness, vitality, all of the emotions that are upregulating, gratitude, all the emotions that are upregulating. And if you want to meditate while I'm in my surgery on that, fabulous. So when I go in for my surgery, I did a few things out of the box in that I put a fake tattoo on my limb that was going to be amputated. So first of all, wanted to make sure we got the right leg, and with respect to that, it had butterflies and it had like be free because I'm removing that part of my life. And then the second thing was, and the surgical team were like, we don't usually see this with people coming in, so they were in a pretty good mood. The song that they play when I'm in the OR room before I go into Twilight is Faith by Ariana Grande and Stevie Wonder. And I end up not doing a general anesthetic. I did an epidural with Twilight. And so when I came out of the surgery, I felt amazing. And then when I go into the amputee hospital, my second and third nurses' names were Grace and Joy. I mean, you can't make this stuff up, right? And 18 days later, I get released to come home to have an overnight home. And of course, I didn't tell I didn't tell my docs I'm coming home and I'm seeing patients. So I'm seeing patients while I'm home, which was amazing. And when I literally say to people in the oddest of ways, this has been one of the easiest things I've ever done because I've had to sit in the unknown. I've created the future and brought that future to me in the standpoint of how I feel, in the how I want to feel, like grace, joy, peace, gratitude, love, that sort of thing. And sitting in that emotional state, then having the awareness of what you're vibrating at coming to you. So long and the short, one of the things I struggled with was, as a chiropractor, I think I'm doing all the right things. How come I got that with my foot, right? And I've had people say that, oh, if you're so good, how come you had cancer? And I'm like, well, obviously I'm not that good, But but it was really more related, I believe, to the frequency of which I was naturally vibrating at, where I was still trying to force the response of what I was wanting for healing, versus allowing for example, the meditations to occur without forcing the outcome. And so I don't feel badly in the decision that I made, because in the decision that I made, for some reason, that allowed me the freedom to create a whole new me to move myself forward. It may sound odd that you have to do an amputation, but it was it's been so transformational, and there's been ease to it. And literally, when I say things have come to me, I've got like 20 stories of things that have come to me that I don't think I would have accomplished had I not had that done.
That's incredible, Liz. I love your perspective. I love your energy. And I want to ask you, just as you're going through this story, this is amazing to me. Do you ever find, going through this journey, do you ever slip back into perhaps the negative aspect of the vibrational energy, where you're facing, whether it's physical challenges or adapting to this new life on a physical level? Do you ever find you slip into that vibration and you have to consciously get yourself back to where you just were?
Yes, I have caught myself doing that. And I would say that the refractory period is far less, because you start to feel where you're feeling and it's like, ooh, I don't like that. And then that makes you notice, what was I thinking and what am I doing? And it's like, oh, good Lord, let's change that around. So a couple of examples I can give you is when I did first come home. Um, so I don't have a leg. I've got a walker. So I'm having to hop using a walker. And I'm coming in from the garage. We've got a big heavy door that's on a spring. And I remembered thinking, oh my God, I'm going to fall. Because in the amputee hospital, everything's about mitigation of stopping people from falling. You have to earn the right to use a walker, getting out of a wheelchair, because we don't want you to fall. So everything was about fall, 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 fall. And I had allowed that to be so embedded in my neurology. All of a sudden, when it came up to a challenge, the first thing I'm thinking is falling. It's like television, tell a vision. It's just not what I was wanting to do, but it was embedded when I was somewhat in trance. Anyway, so all of a sudden I have this sort of metacognition moment of where I'm here, and then I look at myself from another perspective at me going, Liz, what the heck? Because I was like, I'm looking at my husband saying, Barry, I can't get in this door because I'm going to fall. But then I stopped. And then I had this moment of me looking at me from a different vibration. And it was, what do you need? I need safety. I need to know that I'm safe. And so what do you need to feel safe? Okay, well, I don't want to fall. Well, what's going to happen? You can fall forward, you can fall backwards. So it's the likelihood. So I thought, okay, Barry, you stand behind me, keep the door open. I'll move my walker on the other side of the door frame because it's kind of a weird shape. And I'll just hop over, and I've got that. If I'm going forward, I've got it. I'm strong enough to hold. And if I'm going back, blah, blah, blah. So I do my hop, and I started laughing because it was so easy. It was so easy. And my mind was paralyzing me from making this baby step. But I caught myself in stopping myself from that old Liz into a new Liz of just, let's move forward. Another example I can give you was, recently I was swimming in the local pool, and I don't swim with a leg on when I'm in a pool, but I put my leg on at the side of the pool, walk to the washroom or the showers, take the leg off, have a shower, put the leg on, and then get dressed and go home. So I don't know what I was thinking, but I put my towel too far away from where my leg was. And normally I would not even worry about it. I would just sit and scooch myself along the floor to get the towel, pull it down. But for some reason I said, I'm just going to hop and get my towel because I can hop, but you're on a wet tile floor. So I hop, leg goes out. I come down right on the end of my stump. Ugh, it was like, imagine just middle of your shin, you come straight down on bone. There's nothing there to protect you. I cut the end of it, and I'm just like, the pain was just like, ugh. And I'm like, okay, Liz, bring yourself into where you need to be. And so I got myself recombobulated, got myself dressed, forget the shower at that point, get myself home, and sort of really inspect what I'd done. And then I'm thinking, I'm going to have to cancel the week because this pain is crazy. And then it was like, whoa, 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 just wait a second. Like, who's to say your potential has to do that? And so I had an adjustment scheduled that day. I canceled it because I literally couldn't get even in, I couldn't load it. So I went, I laid down and I did a few meditations. I put some, couple of essential oils on it, put a certain sock that I have on it. That night I go to bed, I do another meditation, and I'm in this beautiful space of just, it's called changing boxes. So I'm going from the box of where I just injured myself to the box that I want to be in. And then I just drag my body to that future box as it's now. I wake up the next morning, there is no scab, there's no cut, there's no pain, there's no swelling, nothing. It's completely normal. Like there was no sensitivity whatsoever. And so that's another example of it's like, wasn't necessarily expecting that. It was very much being in the unexpected. And that day was great because then I could get up and get my adjustment, which I definitely needed as well. So those are some examples of just sort of where, life does happen in between the moments, right? And it's being able to be more conscious, which means attention in the present time, to note what we're doing and then making a decision on what direction we want to go in, versus being unconscious and running the programs, which most of us are running programs all day long. And, when I'm coaching people and I'm saying, is that the truth or is that a belief? Right? And that's the big key, is that we have all these beliefs about ourselves that we've taken to be true, whether they're real or imagined, but we just make assumptions that they're true. Oh, I'm not a good student. Oh, I'm not a good whatever. Oh, I'm too overweight. Oh, I'm too old, whatever it might be. And I say, is that really true?
It's amazing. Your ability to put conscious awareness into your experience is really incredible. I love listening to it. And I was just going to ask you, actually, you just brought that up, is that how have your life experiences helped you with the coaching you do? And explain a little bit, if you will, just about the type of coaching you do and the type of clients that you see.
Right. So I'm not interested in long-term coaching. I'm not interested sort of for beginner coaching. I don't have specific programs. I'm more for people that are stuck in a problem and want some solutions around that. So it's more short term. And I actually enjoy working with people that have been coached before because they're somewhat familiar with the process. But sometimes I'm also working on uncoaching them because they have on occasion, they have been taught to not make a move unless they have a big daddy or big mommy telling them that that's the right direction, versus saying, what does your heart tell you to do? And that's really the key piece in my coaching, is that we are far more creative and resourceful than led to believe. However, if we are living by the hormones of stress and the physiology of stress, that creativity is very much minimized in how we can access it. And so it's a matter of, let's get rid of some of this other stuff. Let's figure out what you want to create and how you want to feel once that's created. Let's reverse engineer, and then let's create steps, and then it's accountability from there.
That's wonderful. Awesome. So I want to ask you, because I know when we were scheduling our date today, you were traveling, and I know you love to travel, and you've been all over the world. And I'd love to hear just some of your journeys and experiences, and especially since this later part of your life, now that you're out of full-time practice, you're in your boutique practice after your surgery. How has that affected your travel, and where have you gone? What experiences have you had as a result of that?
Oh my gosh, I've been all over the place. I mean, I'm a diver, and so that was a whole other experience, because the first, all the physiatrists and the podiatrists said to me, "Oh, you can't dive. Your diving days are over because you." And I'm like, "Well, I'm on liveaboards. I need to get back into a boat." And they're like, "Well, no, it's just not going to happen." I'm like, "Yeah, it is going to happen. I've already seen it." And so again, bringing something to me. So I was in Oklahoma City. There's a particular prosthetic that I like, and I'm down there. And the fellow, as he's putting it on, I'm talking to him about diving. I say, the one that you've created for me won't work diving. I know that. But I know there's something there. There's a swim foot I can use, and it's going to let me, plantar flex, and I can articulate on a flipper. So I've got a nice flipper. But I need a socket that's not going to fall off at barometric pressure change or have water get in, blah, 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 blah. And he goes, "Oh, well, it just so happens I happen to have the Navy SEAL that retrains amputated Navy SEALs and getting them back in the water. Would you like to speak to him?" So, like, duh, yes. And so that's what I mean by things come to me. So I've done probably about 400 dives since my amputation, and I've been all over, like, oh my gosh, Galapagos, Australia, Indonesia, Maldives. That's where I first did my first diving after, as an amputee, was in the Maldives. Like, let's go into some rip currents and just start diving. Like, it was funny. But I was a diver before. And so that has brought amazing experiences with it, and super strong leg, actually, because it just works like a longer fin, which works really, really well. And then, yeah, and then I would say the other thing was interesting is in some of the areas, like in Australia, in Cambodia, and Thailand, the heat is an issue at times, because you sweat inside the liner, and then it starts to slip, and then you can get blisters. And so I've just mitigated that with taking, like, a washcloth with me, take my leg off, dry it off, put some rubbing alcohol on the liner itself, dry it out, and then, slip my leg back on. So it's an inconvenience, but it's nothing that is not doable, and it doesn't stop me. I'll put it that way. What else? I mean, yeah, we just got back from Italy. There was some very tricky terrain to deal with in the path to the gods on the Amalfi Coast. And it was really cute because I had shorts on just because it was easier than pants, and it was warm. And I remember a couple of people saying, like, "Awesome," because like they can see I'm an amputee. And sometimes I have a lot of fun with it as well, right? In the standpoint that I make light of it, in the standpoint that humor sometimes helps people to feel at ease as well with themselves. And so I do have a lot of fun with, I've got all my sort of jokes ready to run with kids that are staring at my leg and things like that. And I want them to be able to learn how to ask if they have permission to, if a person wants to respond to them. And of course, I'm very happy doing that, but some amputees or other people might not. And it's really cool. You see sort of the transformation in other people by doing that as well.
Wow, you have such a great perspective, Liz, and such a great energy about you. I'd love to know. So, and to respect your time, I want to kind of close with a few questions, if you don't mind.
Sure.
So we have a lot of viewers, and I do have the privilege of coaching a lot of young chiropractors into practice, or perhaps chiropractors that are struggling, and want to grow. and which has been just absolutely fun for me. So, what advice would you have with the experiences that you've had going through the profession and obviously the challenges and joys and big wins in life? What advice would you have to those young chiropractors who are maybe thinking about chiropractic college or in chiropractic college, or maybe young chiropractors just into the profession?
So I think ultimately you need to look at what is it that you enjoy doing. And to me, if you're looking at practice, it's physical. If you don't like to be physical, then you might want to be looking at something else or a different part of the profession, like research, if that was the key piece on that. But generally, we're in a palpation dominant profession, and I like to use the Tanner model on almost everything these days. And so the advice I would give is it's a 4-step model, but you can apply it anywhere in your life. Notice, interpret, respond, and reflect. So notice is about being present. It's about an awareness and what are you experiencing in the moment when you're observing someone else and palpating someone else. What is the meaning that you're going to assign it? So that's interpret. What does it mean? Does it mean I need more information? Does it mean this is something in process? Does this mean something's emerging? Does this mean they need to be referred? Does this mean I can take care of it? Those sorts of types of things. And the same thing too with students is always remember that when you're learning something, what is the deeper meaning behind why you're learning it, right? And that makes it easier to remember. So notice and interpret. Respond is if there's a response required, and the response could be no response. The response could be adapting on the fly. As we know, when we're seeing patients, you're about to adjust them and they say, oh, by the way, I had a fall down a flight of stairs. It's like, okay, let's maybe reassess you first with what's going on, or there's something else that's emerging. So your response and what your plan may be has to adapt. And then the most important is reflection, right? Reflection is, am I going in the direction of what my heart tells me to do? Am I going the direction of my dreams? Am I feeling the feelings I want to feel? Or am I off my true north? When I'm dealing with my patients, what am I learning about myself through my patient that I can do more of or less of? Where do I need to make that patient more responsible and basically be the mirror for them? If they're doing nothing to help themselves and they keep complaining about the same thing, we need to be talking about that, right?
Sure.
So,
Sure.
so those are things I think that are important.
Who's been the biggest influence on you through your life and through your career? And what's the best advice that you've ever received?
I would say the best advice is to listen, and listen with the intention, what's really called active listening. Another one would be compassionate latitude, and compassionate latitude is having the perspective of the other person coming to you, and they're trying to do the best they can with the situation that they're currently in. And if we see them with that sort of lens, then we can be far more compassionate and helpful to them. Doesn't mean we have to agree with it, but it's from their perspective. And my biggest mentors, there's no question, Jim Carter was a huge mentor for me early on. John DeMartini as well. That we're talking in the 80s for both of those. I would say Joe Dispenza in the last 15 years in teaching, creating the opportunity for me to really learn how to meditate properly, and more than 5 minutes. And they've all been great gifts, just because they're all about taking responsibility, commitment, and self-reflection. And it's not the self-reflection where it's about beating yourself up. It's the self-reflection of, what am I learning about myself, and how can I bring me, a greater version of me, to the table in this scenario.
Wow. Wow. So what, if I can ask you, what's next for Dr. Liz? I mean, you've got your boutique practice, you're traveling, you're coaching. Are there any big, hairy goals for Dr. Liz down the road?
I would say no. I'm sort of living in this place of the unknown, and I go with where my heart tells me. And there's things that I have on tap right now that I'm pretty much booked for the year, and it kind of happens like that. I don't tend to seek it; it finds me, and so that gives me a lot of flexibility. And being in my senior years, I am really enjoying so many parts of being able to still see patients and still take still see this transformation that occurs. And also, I've got 5 grandkids, and so that's really a cool area of the life. And my husband is another cool area with travel, and we travel really well together. We love doing the same things. So there's all sorts of things that crop up like that. And so I tend to not be as forcefully goal setting the way that I used to be driving, in that, as I said, I've got 2 half marathons on my list. I got a tumor on my foot. That's all right. I'll just do it. Tick, tick, done, and then not enjoying the process. Right. And that's another key thing, is sometimes we get so focused on the goals. And I remember that when I used to see a lot of people, it was focused on a number. And it's like, yep, done. Now, next goal. And I didn't even celebrate when certain things happen, certain milestones. So I think that's really the key, another key piece too.
That's huge, huge advice right there, and definitely something personally I can take forward. So thank you for that. Where's the next travel destination for you?
Well, we just got back from Italy last Tuesday, as a matter of fact. So I think the next one, I am in Australia, New Zealand, and then I'm back in through Bali into Indonesia to do some diving and Salt Lake City. It's gonna be a busy fall, but right now the summertime's a little bit more family focused, which is awesome.
Wow, amazing, amazing. Well, Dr. Liz, this has been absolutely wonderful. I want to ask, where can people find you? If something that you've talked about today has resonated with somebody, or somebody wants to reach out to you, maybe to inquire about coaching, or just to be able to talk about, your perspective on different things, where can they find you?
Sure, super simple. It's drliz at drliz.ca. So Dr. Liz at drliz.ca. And I'm on Instagram under DRLIZAP. So Dr. Liz AP for Anderson-Peacock. Same thing on Facebook as well. That's the easiest way.
Awesome. Awesome. Well, Dr. Liz, this has been absolutely a delight for me, and I really appreciate the chance to get to know you a little better and hear your story and just be around your energy, which is very contagious. So thank you very much for doing this.
Thank you, Dr. Colin. It's been a delight to do, and hopefully I've added some value.